We're a group of clinicians that have a real passion for solving healthcare challenges through digital innovation. And our mission is to push the boundaries of what healthcare professionals can create and achieve using digital innovation. So essentially, there's three of us that co-founded CodeMed. I'm Aaron, a GP trainee at St Thomas's Hospital and former Deputy Lead of Emerging Technology at the UK Government's Department of Health and Social Care. I'm also an NHS clinical entrepreneur and a Digital Health London Digital Pioneer Fellow. Joe is also a co-founder and is working with me at Guy's and St Thomas's NHS Trust as an anaesthetics trainee. Throughout his training, he's won multiple awards for his commitment to health service improvement using digital technology. As well as that, he's a self-taught Flutter developer. Imran, well, credentials speak for themselves, really. He's a microbiology consultant, a principal medical consultant for Amazon, a UCL honorary professor, an NHS clinical entrepreneur, and is a computer science by background. As well as teaching other healthcare professionals how to code, we also build apps ourselves. The first app we built together was an antibiotic calculator app. We found out essentially that gentamicin, amikacin, vancomycin, teicoplanin are frequently poorly prescribed in NHS trusts. And we actually did an audit which showed that around 12% of gentamicin prescriptions out of 6,000 prescriptions we audited were prescribed at 1.5 times the dose that they should have been given, which obviously risks renal toxicity and also ototoxicity. And of course, it's a completely avoidable patient risk. So we created this app which reduced prescribing errors down to zero and also reached the finals of the Health Tech Newspaper Awards. More recently, we've also released an app called IALS. Those of you who have iPhones, you can download on the App Store, just type in IALS. And essentially it's designed to streamline the management of in-hospital cardiac arrests and reduce the impact of human factors. One of the more recent apps we've been working on is something called SimEPR, which is on the top here. It's a mock EPR system that's designed to be used during simulation training. So eliminating the use of, paper records, paper drug charts, which are not realistic. You can do your simulation training with paper records, but actually in real life, when you're a doctor, you'll be using electronic systems. So this is a customizable EPR system where you can create clinical scenarios for teaching purposes. It's worth noting that all of these things we've built ourselves. It's costed us absolutely nothing to build because we haven't paid for a developer. So we've gone straight from idea to building a fully functional product that's being used in real clinical settings. Why are we so passionate about digital health? Well, it's kind of obvious, when you look around, digitization has radically transformed practically every industry. You want to buy something, you can hop onto Amazon app and buy something, get it delivered the next day. Everywhere you look around, digitization is there. And healthcare is no different. In fact, digital is mentioned over 90 times in the NHS long-term plan. It's a real drive to digitize healthcare. We believe in order to fully harness it, the users, being yourselves as clinicians and medical students, you must be able to understand, adopt, create and improve services for us to actually effectively use this technology. And that's why it's so important that people like yourselves have an understanding of how software works, how to code, how to build solutions. So you are essentially the key to this digital health solution. There's also another way to think about it. We know there's a motive for digitization in healthcare. This gives you an opportunity to do various things. So if you're an academic person, there's a lot of research around digital health technologies. A couple of years ago, I published some research on the use of mobile health apps in surgery. There's also opportunities in terms of businesses and startups. So if you're able to build a product that you can demonstrate saves money, you can build a business based on that because you can say to an NHS trust, well, I'm saving you this much money. If you pay me this much, you're still saving money. And that's how you get a viable business. And then last of all, there's the clinical portfolio side of things. And I mentioned before, all three of us hold a number of positions that are related to innovation and digital health. And having that programming experience, being able to demonstrate that we've built apps and improved healthcare has definitely helped us with our portfolios to talk about in interviews and have on your CV. We offer a 12-week programming course. Everything we do is clinically orientated. So on the right here, you will see a couple of apps that you will learn how to build. This is just a portion of it because we believe that by applying concepts you already know and understand, you can learn things that are seemingly quite abstract. Even though we've started our May cohort, we're going to be doing another one on the 30th September. So if you want to find out more, you want to register, you can visit codemed.co.uk.